Hello, my name is Clay Detlefson. I'm Senior Vice President and Counsel at the National Milk Producers Federation. My team and I have been working hard for you folks in 2020 on a variety of issues. Issues we've tackled in 2020 include working on the COVID-19 response and recovery, facing a number of environmental challenges, animal health issues, nutrition, food safety, and food labeling.
Well, I'm going to go ahead and start my first topic of the day, the COVID-19 update. Last 6 or 7 months have been extremely hectic and challenging for the dairy industry and for the food industry overall, as well as the public health community, first responders, and many others. Challenging times, to say the least. One thing that we learned is, while there's plenty of food in this country, we had some serious distribution channel issues. That created a number of problems for us, and the marketplace got turned a bit upside down. Normally, we tend to have about half of our food products going through the typical grocery store retail chain, and the other half goes through restaurants and food service. When COVID-19 really hit us hard in March, the food service restaurant segment pretty much disappeared or cut back dramatically, leaving grocery stores as the number one venue to get food products. Unfortunately, for a variety of reasons, you can't just switch channels on a dime, and that caused a lot of difficulty for us. We saw shortages of toilet paper, shortages of dairy products, shortages of cleaning and sanitizing chemicals, as Americans rushed and scrambled to get the products they needed into their homes, and as food manufacturers and distributors trying to get the products to the grocery stores so Americans could get them. We also learned that if Americans want food on their table, American workers in food and ag need to be able to get to work and get home from work. We had a number of challenges early on in which law enforcement was detaining workers on their way to a cheese plant or a bakery, and it caused a great deal of problems. We started out in 2020 with the dairy industry doing pretty well. The first quarter was a decent quarter, and this was going to be a year of recovery after many bad years previously. Early in March, though, when schools, restaurants, and food services shut down or scaled back, things quickly took a turn for the worse as that demand disappeared. Changes to the food supply chain resulted in excess milk, which needed to be dumped. At retail, consumers stockpiled and hoarded and created stockouts. When we started looking at what was going on in our dairy processing facilities, we had a lot of issues there too. We had difficulty getting personal protective equipment, or PPE. We couldn't get sanitizing chemicals, swabs, wipes, and hand sanitizer itself. Orders for those products were delayed, canceled, or seized by government authorities. Some workers were afraid to go to work for fear of getting sick. Other workers were afraid to say they were sick for fear of losing their pay. Drivers did not want to go to hot zones because the CDC guidance recommended a 14-day quarantine upon return. Some workers got sick and dairy plants had to shut down. Sometimes it took a week or more for those plants to open back up. Large-scale testing of workers for COVID-19 was very limited. PPE and cleaning and sanitizing chemicals will be tight for the foreseeable future. The National Academies of Science, though, has recommended that the food and ag operations do receive a priority on vaccines when they become available. At National Milk, we've also worked on a variety of environmental issues this year. We've had issues related to water, air, a chemical family called PFAS, and we've been working hard on something that Jamie will tell you about shortly, called the Net Zero Initiative. Big issue that we've worked on for a number of years is WOTUS, which is now referred to as the Navigable Waters Protection Rule. That rule became final in June of this year. Since then, numerous lawsuits have been filed trying to block that rule. The New Mexico Cattle Growers Association said the rule was too broad and needed to be cut back. 3 activist organizations argued, on the other hand, that the rule was not broad enough and needed to be expanded. Considerable uncertainty is going on right now as to what rule will apply if courts start issuing injunctions. Recall that we had the 1986 WOTUS rule, the 2015 WOTUS rule, and now the 2020 Navigable Waters Rule. It's very likely that we will be following 3 different rules if the courts start taking action. With respect to the NAEMS issue that we've also been working on for many, many years, they still haven't finished. It's been 15 years, but they're making progress. Right now, it's anticipated that the dairy farm models for air emissions will be released in December of 2021. Those models will deal with things like hydrogen sulfide emissions, ammonia emissions, and particulate matter. And then a year from then, we'll probably see another model released on volatile organic compounds. We're anticipating seeing that in February of 2022. You've probably heard a bit about our next issue, PFAS. It's caught a lot of attention in the food and dairy industry, even though it is really a water issue. PFAS are forever chemicals that have entered the environment through sewage sludge, industrial waste, unlined landfills, and firefighting foams, and they all tend to persist in the environment for decades. While it is a water issue, some milk has tested positive for it in New Mexico and Maine. We've had 2 farms basically put out of business in Maine and 1 in New Mexico. Both states are now doing different forms of testing to try and ascertain what the situation is. FDA tested food samples as part of its total dietary study, and thankfully, all of those came back negative, with the exception of 1 sample that tested positive for PFAS, and that was a fish called tilapia. EPA's got a lot of work to do on PFAS. It has issued a preliminary determination that it will regulate PFOA and PFOS. Those are 2 of the most common PFAS chemicals. They have developed new scientific methods to accurately test for 11 additional PFAS chemicals in water. They've announced the availability of $4.8 million in funding for new research on managing PFAS in agriculture. Things like, how does PFAS get taken up by various crops when it's in the soil that those crops are grown in? They have also issued interim recommendations for addressing groundwater contaminated with PFOA and PFOS. Jamie, I would like to now turn to you, have you talk to the folks about the Net Zero Initiative.
Great, thank you, Clay. I'm Jamie Jonker with the National Milk Producers Federation in the Regulatory Department, and it's my pleasure to give you an update on the Net Zero Initiative. You may recall that I briefly introduced the Net Zero Initiative at last year's annual meeting. Well, there's been a lot of development in the past year, and I'm going to walk you through what has happened over that last year period. I think the first thing to focus on is the announcement last April about the 2050 U.S. dairy sustainability goals. Collectively, those goals are to become carbon neutral or better, optimize water use while maximizing recycling, and improving water quality by optimizing utilization of manure and its nutrients. But it's a marathon, not a race to get to 2050. And so how do we get there? The Net Zero Initiative is part of that process. Net Zero is looking to break down barriers so that we can achieve net zero greenhouse gas emissions and significant improvements in water quality from the field through the farm gate. There are now 3 defined work streams within the Net Zero Initiative. There's the groundwork, which is a foundational work on environmental and economic analysis, research and measurement to inform decisions, updating models, and advancing outcomes that will benefit dairy farms of all sizes. There's a dairy scale for good, an expedited economic and environmental projects on a small set of pilot farms to prove the business case and decrease capital costs and create additional revenue streams as a catalyst for solutions for all dairy farms. Then finally, collective impact. collaborative action to stimulate greater access to technical, financial, and educational support to motivate the adoption of environmental practices across farms of all sizes, in all regions, and all types of farming systems. There are many places we can look at in a dairy farm system, on every dairy farm from small to large, in every region across the country. This is just a little bit of an example of places where we can look to improve technology, optimize the use of resources so that we can get to net zero. I'll briefly walk around the farmstead that we see here. And remember, this is just some of the things that may be able to help our dairy farming community get to net zero or better. On cow care and efficiency, we can optimize feed rations. There may be feed additives that can reduce methane emissions from the cow. Of course, we have the long-term genetic progress that has been made through today that will continue through 2050. Renewable energy options and energy efficiency, such as biogas into electricity, LED lighting, solar and wind power. Things that we can do in manure handling and nutrient use, such as reducing liquid manure storage, technologies to capture and separate nutrients, improve nutrient management planning, and anaerobic digesters to turn manure into biogas, and better feed and improved feed systems, such as no and low-till farming and cover crops, renewable fertilizers, and precision agriculture. Underlying all of this is a coordinated approach across all of the dairy enterprises, working in a coordinated fashion to make this a success. It's important to remember that not every dairy farm is expected to be net zero by 2050, but we're collectively looking to be at carbon neutrality or better by 2050. Each dairy farm will have the opportunity to choose from the suite of practices and technologies that works best on its individual farm. So what happens on a farm in New York may look different than what happens on a farm in New Mexico. And that's okay, because this is an individual journey for each farm owner, but a collective journey for the entire dairy industry. With that, I'm now going to transition into our animal health updates. And joining me at part of this presentation will be Michaela Hanselman. We're going to look at antibiotic use and antimicrobial resistance work in the past year, foot and mouth disease preparedness, and bovine tuberculosis eradication. Beginning with antimicrobial use and antibiotic use, this is one of my most favorite slides to give an update on at each town hall session at our annual meeting. This is the percent of bulk milk tanker trucks that test positive for antibiotic residues. As a reminder, all tanker trucks must be tested for antibiotic residues in accordance with the Pasteurized Milk Ordinance. Going all the way back to 1996, we had a very low incidence of 0.104% of tankers testing positive. Moving forward over 2 decades, that's now down to 0.009% of tankers testing positive. That's about 1 out of 11,000 tanker trucks, a very small number indeed. And importantly, as we all know, if a tanker truck does test positive for a residue, that milk does not enter the commercial system. We also have an improving story that we can tell on dairy cull cow tissue residue violations. As you can see here, over the period of 2014 through 2019, we've had a reduction in dairy cull cow tissue residue violations by about 40%. That's a pretty dramatic drop in such a short period of time. Bob Veal tissue residue violations are another success story for our dairy farmers. We see a drop here from 2014 to 2019 of nearly 70%. There are a couple of factors that do play into this specific drop on Bob Veal, probably the largest being the change in the availability of neomycin from an over-the-counter antibiotic to an antibiotic requiring a prescription, including if it's used in milk replacer. And that change did occur between 2014 and 2015. But you'll also notice a decrease in most of the other drug residues as well. And so again, this is a good story that talks about the important role and responsibility that dairy farmers take in the judicious and responsible use of antibiotics on their farm. However, I do have to add that the entire story is not always rosy. And I think it's important for us to also acknowledge points that are not as positive. And that is, out of all of the residues that are found in animals at slaughter, dairy cull cows and Bob Veal represent almost 80% of those values for 2019. That means that we're 80% of all the residues that are found in dairy animals, beef animals, but also poultry and swine and small ruminants like sheep and goats. And so while we have a great success story here over the past few years, we need to remember that we still have more to do. We need to get our overall tissue residues in alignment with the great success that those other sectors in the livestock arena have done. Moving on, I want to talk a little bit about the Appendix N drug residue pilot program. With great success, the program was actually completed at the end of last year. And the great news is that we found only 1 in 58,000 milk trucks to have a tetracycline residue, substantially lower than the very low amount in the routine testing that's required by the PMO already that I gave earlier in this presentation. And the residue pilot program has completed. It was designed to test how would we add another drug to the routine testing of antibiotics on milk tanker trucks. It answered a lot of questions about implementation from the farm through the milk collection to the plant level. Now we're moving into the next phase, which is a potential new multi-drug surveillance program. This is in development in coordination with the Food and Drug Administration, our state regulatory partners, and us as a dairy industry from cooperatives and processors and dairy farmers. FDA is intending to fund this sampling, and it would be double-blinded, meaning that this is a surveillance program and not a compliance program. It's designed to see if there are other drug residues that should be tested on a more frequent basis. I think what we'll find in this, though, is that we probably do not have other drugs that will be of concern because of the great work that our dairy farmers do day in and day out. There's a lot of details still to be worked out on this, like which drugs might be included, where might the sampling occur, and when might the program occur. So all I can say at this point in time is stay tuned. There's more to come on this. Now a couple regulatory updates on the antibiotic realm. The first is an FDA request for comment on 0-day withdrawal in antibiotics and milking frequencies on U.S. dairy farms. Every so often, FDA must update the assumptions that it requires our pharmaceutical companies to work through when they are getting a new drug approved for use in animals. They need to have the best understanding of what the industry currently looks like and practices. The last time FDA updated these assumptions was over 20 years ago. That means that their picture of what the dairy industry looks like is vastly different than what it actually is. So we were able to provide a variety of detailed information, including to be able to utilize information from the farm program. We were able to update milking frequency information on a regional basis for the percent of farms that milk 2x and 3x. And also something that didn't exist more than 20 years ago when FDA last updated this information, robotic milking. We also utilized an online survey and had hundreds of dairy farmers complete that survey to help us look at what we call attitudinal information on what they think zero withdrawal means for meat and what zero withdrawal means for milk. With that, we were able to submit over 168 pages of comments to FDA, emphasizing your commitment as dairy farmers to the safe and judicious use of antibiotics. Additionally, on the regulatory front, and I've mentioned this a number of times over the past few years, that over-the-counter availability of antibiotics is going to be restricted. Late last year, FDA released draft guidance to the pharmaceutical manufacturers to voluntarily move medically important antibiotics from over-the-counter to prescription basis. In reality, there's only a few antibiotics that are currently available over-the-counter for dairy farmers. So when this change happens, it's not going to be a large change for our dairy farming community. But it was still important for FDA to understand some of the potential challenges that our dairy farmers may have. We submitted comments where we were able to support that move, that voluntary move from over-the-counter to prescription. We were able to use the farm program VCPR data to demonstrate the percent of farms that had a VCPR during their last farm evaluation. That's about 80%, but there are some regional differences, as you can see here. For example, the Mountain Plains region is almost 90%, while the Mid-Atlantic region is only about 74%. So we noted to FDA in our comments the importance of outreach to producers to make sure that they understand these changes when they are occurring. Finally, on antimicrobial resistance, I want to talk about the work that we have been doing with the U.S. Dairy Export Council, working with and advising the U.S. government on our dairy positions, and also working through the International Dairy Federation to help work through the Codex Task Force on Antimicrobial Resistance. This may seem a little arcane, but the Codex documents can be utilized to allow or disallow imports into countries. So there's quite a bit of importance in what the Codex documents say. In this case, we felt like we had big wins at the last meeting, where we were able to get a definition of animal-only antibiotics, like monensin, and able to protect the 3 uses of antibiotics that are allowed by the Food and Drug Administration: treatment, control, and prevention, with definitions in the documents. Now, this is not a done process yet, and there has been pushback from the European Union, Russia, and Norway, even at the very highest levels within the Codex Commission. So we must remain diligent and work with the U.S. delegation, IDF delegation, and others. And again, we continue to work closely with the U.S. Dairy Export Council because exports are now over 15% of our domestic production. Moving on to foot and mouth disease preparedness, I want to remind you of the priorities that NMPF established way back in 2014, which is a long time ago, but in terms of government, is barely around the corner. Through our National Milk Animal Health and Wellbeing Committee and approved by our board of directors, we had 5 priorities: in vaccine use in the U.S. during an outbreak, vaccine research and antigen bank capability, laboratory and field diagnostics, the secure milk supply, and on-farm biosecurity and education materials. And I want to say that while we still have a ways to go on each of these, there's a lot of completion that has happened on each of these priorities in the past 6 years. Just going to focus on recent developments in this arena. The first part is the foot and mouth disease vaccine bank modernization. National Milk and other livestock groups made it a priority in the 2018 Farm Bill to secure funding specifically for the FMD vaccine bank. And I'm happy to announce that in July, USDA announced a purchase of $27.1 million of FMD vaccine, the first in a 5-year commitment to modernizing the vaccine bank with additional vaccine, both in quantity and in quality. The other thing I want to mention is the next generation FMD vaccine. Zoetis did a petition to manufacture what's called an attenuated FMD vaccine on the U.S. mainland. This is using the leaderless vaccine technology, which allows for rapid development for additional strains. The importance of being able to manufacture a vaccine on the mainland of the U.S. means that we would be able to deliver vaccine when needed at a faster pace. So this is delivering on the idea of what the next generation of FMD vaccines can be. And we look forward to the future developments of this. Finally, on the Secure Milk Supply Plan, there are now numerous state and regional coordinated activities happening in this arena. And just in September, National Milk submitted a USDA grant proposal. This grant proposal program actually was an additional result of National Milk and other livestock group outreach and priorities in the 2018 Farm Bill. This is a direct result of all of the hard work that you did in helping us convince our members of Congress the importance of foot and mouth disease preparedness in the Farm Bill. We submitted a $480,000 grant application to integrate the Secure Milk Supply Program into the farm program, with a goal to help facilitate transfer of information from farms to state and federal animal health officials in the event of an FMD outbreak. We don't know whether or not we will get funded yet, but I think that USDA is going to see that the farm program is the right place to integrate the Secure Milk Supply Plan. And I do hope that they approve our proposal and that we can report next year on great progress in this arena. With that, I'm going to turn it over to Michaela Hanselman to talk about tuberculosis.
Thank you, Jamie. My name is Michaela Hanselman, and I'm the Manager of Regulatory Affairs. Today, I'm going to talk to you about the NMPF Tuberculosis Task Force. In 2019, NMPF established the Tuberculosis Task Force, similar to the task force which was established for FMD, made up of 5 members who are vets, farmers, and co-op staff. Throughout this year and last, the task force has been participating in webinars with state veterinarians, USDA, and tuberculosis researchers to learn about the state of tuberculosis in dairy cattle in the U.S. Through this, the task force will develop TB policy priorities for the dairy industry as USDA works to update the National Tuberculosis Eradication Program. USDA has been busy working on various tuberculosis topics. In September, USDA updated the brucellosis and bovine tuberculosis import regulations. The updates include addressing issues raised, clarifying definitions and requirements. It also removes age limits for testing imported animals and expanding the TB testing requirements for sexually intact animals imported for breeding or feeding. In addition to updating the eradication program, USDA has proposed 2 new research studies that tackle sources of TB infection in dairy cattle. One being vaccinating deer for TB in Michigan, and the other being a 5-year study vaccinating for TB on dairies in Baja California. And lastly, RFID tags, which would be required for interstate movement under the proposed RFID rule by January 1st, 2023, increases traceability if there were ever to be a TB outbreak. Next, I will hand it over to Clay to talk about nutrition, food safety, and labeling issues.
Hello, I'm Clay Detlefson, Senior Vice President and Staff Counsel for the National Milk Producers Federation. Michaela and I have been working on a number of food safety and labeling issues for you folks in 2020. Michaela and I will tell you about some of those right now. First, we're going to talk to you about the labeling of fake milk products in the marketplace. Michaela will tell you about the dietary guidelines for Americans, and she'll also talk to you about ultrafiltered milk and its use in cheese. I will talk to you briefly about the Food Safety Modernization Act's intentional adulteration rule and its potential application to dairy farms. And then I will update you on what's going on with NCIMS in this COVID-19 world. First issue I wanted to mention briefly is that National Milk has been asking the Food and Drug Administration to enforce the standards of identity for any product that uses a dairy term that is not a dairy product. Basically, these plant-based beverages, cheeses, if you will, and other products. Those do not follow the rules. They are unlawfully in the marketplace. But despite decades of National Milk insisting that FDA do something, to date they have not. Well, California got fed up with FDA's inability to take any action. And last year, they sent out a number of warning letters to plant-based food manufacturers asking them to stop doing it. And they specifically called out a number of things. With respect to Mykonos vegan butter, the California Department of Food and Agriculture told them they needed to remove lactose-free, hormone-free, revolutioning dairy with plants, cruelty-free from their labels, and stop using the word butter. Miyoko's Kitchen decided to fight back and in February filed a lawsuit against CDFA, arguing that their First Amendment rights were being violated and that they did not want to stop the practices that they were doing because it would be too costly. Miyoko's won an early round in the court when she got an injunction issued against the California Department of Food and Ag with respect to prosecuting her for the use of the word butter on the label. For now, the California courts have stated that they should allow that to occur. So California cannot enforce its rule with respect to butter. But Miyoko lost on a number of other counts, and this litigation has a long way to go. Another issue that we've been working on, or a related issue, is a variety of different dockets that FDA has. Dockets are used when FDA engages in rulemaking. FDA had put out a request for stakeholder input with respect to how standards of identity would be removed, modified, or created. FDA identified 13 principles that had to be followed whenever a standard of identity was created, removed, or modified. National Milk took that opportunity to compare what the plant-based food manufacturers are doing and how that would mesh up with the 13 principles involved in the standard of identity. In almost every single principle, we were able to clearly show the FDA that the plant-based food manufacturers are not following the principles, and again, that they are not following the rules. So we're hoping that this activity and the countless other activities that we've been doing will finally get FDA to take the much needed action and end the nonsense in the marketplace. We've got one more bullet left in our gun, and that's a letter that we've been working on to go to the FDA Ombudsman to ask for her help in ending this stalemate with FDA and get them to do what they need to do. Michaela, I'd like to now turn it back to you to let you talk about the dietary guidelines for Americans and the use of ultrafiltered milk and cheese.
Thanks, Clay. As he mentioned, I will be talking about the dietary guidelines for Americans. USDA and HHS have been in the process of updating the dietary guidelines for Americans, which is done every 5 years. This is a lengthy process which started in early 2019 when the Scientific Advisory Committee was selected to review the newest science. They then released the Scientific Advisory Report, which is their recommendations to USDA and HHS on how to update the dietary guidelines. Overall, dairy fared well in the scientific report, with the key points being dairy maintained its own food group without the inclusion of any plant-based products. Dairy was included in the new guidelines for birth to 24 months of age, including cheese and yogurt recommended for 6 to 12 months, and all dairy was recommended for 1 to 2-year-olds. In addition, as in the last dietary guidelines, servings of low-fat and non-fat dairy were recommended in the healthy U.S. and vegetarian eating patterns. The daily saturated fat limit remained at 10%, the committee recognizing the need to look at newer science on saturated fat in their future directions chapter. The final policy document with the updated guidelines is expected to be released by the end of the year. NMPF has been advocating for the recognition of the newer science and full-fat dairy products through many avenues, including a joint letter to HHS and USDA with IDFA. Both sets of our oral comments and written comments highlighted the need to look at the newer science on fats, a meeting with Undersecretary Lips, and a letter from Congress to USDA and HHS initiated by NMPF. Now I will talk about the ultrafiltered milk docket. In December of 2019, FDA reopened the ultrafiltered milk comment period from 2005 to gain additional insight about whether microfiltered and ultrafiltered milk should be used in the making of standardized cheeses. Prior to the reopening of the docket, FDA has conditionally allowed the use of ultrafiltered and microfiltered milk use in cheese making. NMPF submitted joint comments with IDFA in support of the proposed rule, as long as the ultrafiltered and microfiltered milk were liquid or in liquid form. The UF and MF milk can be made in plant or come from another plant, and if UF and MF are used, it would be labeled as milk on the ingredient statement. The docket closed in August, and we are waiting to hear how it plays out. Clay, back to you.
Thank you, Michaela. I've got 2 more issues for you folks, and we'll call it a wrap. When Congress passed the Food Safety Modernization Act a number of years ago, there was one rule in that act that had a very unique attribute. Basically, it's the intentional adulteration rule, one of 7 major rules that the Food Safety Modernization Act created. The unusual attribute in the intentional adulteration rule was a congressional statement that the rule would not be applied to farms except for dairy farms. So FDA has had the authority to regulate dairy farms under the intentional adulteration rule since Congress passed that law. FDA has not taken that action. They've talked about it from time to time. National Milk and our colleagues over at the International Dairy Foods Association have pushed back on FDA for years and years and years. Ultimately, FDA agreed that it would postpone any action on that until such time as the issue was brought up with the National Conference on Interstate Milk Shipments. Finally, this year, FDA did write to NCIMS saying that they would like to study this issue with the NCIMS stakeholders. So that issue is currently in process. National Milk continues to believe it would be a mistake to regulate dairy farms under the intentional adulteration rule. In particular, if we look at the statutory language that Congress created, and they said that the rule should only be applied to foods where there is a high risk of intentional contamination. National Milk does not believe that situation exists, and therefore we should not be regulated under that rule. We are happy, however, to work with the Food and Drug Administration and other NCIMS stakeholders and explore the issue and hopefully convince them that it doesn't make sense to include dairy farms in that rule. The other issue I wanted to just briefly mention to you is the NCIMS conference itself. The NCIMS conference is supposed to occur in April 2021, but given the COVID-19 situation, we think that is an unlikely event to occur. If you look at the projections for the advancement of the COVID-19 disease, by February of next year, it could potentially be 4 times as many infections as we have today. If that is the case, it's clear that the spring of 2021 would not be a good time to have that conference. FDA has taken a look at whether the conference should be held elsewhere, and in collaboration with NCIMS stakeholders, they are talking about potentially holding that conference in the fall of 2021. It's hard to predict where we will be with COVID-19, even in the fall of 2021. So we'll have to take a look at that in order to decide when or if we should cancel the conference altogether. National Milk has sent out a survey to its membership to get people's sentiments on whether they want to try and proceed in 2021 or if they would be more interested in waiting until the situation becomes clearer and potentially vastly safer due to the development of vaccine and other counter COVID-19 measures. And that pretty much wraps it up for the regulatory department, and we greatly appreciate your time and attention with us today. So have a nice day, be safe, and drink your milk.